Your doctor tells you to cut the salt. You do it, carefully, meal after meal, week after week. And yet, when you check your numbers again, almost nothing has changed. So, what is actually going on inside your body when the one piece of advice everyone gives you simply does not seem to work? Here's the truth almost nobody explains. Salt is not irrelevant, but for a huge number of people, it was never the real driver of their high blood pressure in the first place. It is one small piece of a much bigger puzzle, and when doctors only talk about sodium, they skip over the deeper mechanisms that are actually pushing your numbers up. Today, we are going to walk through those overlooked mechanisms, the nutrient gaps, the hormonal shifts, and the metabolic patterns that quietly raise blood pressure in millions of people, often without them ever realizing it. And once you understand these root causes, you will see why so many people bring their pressure down noticeably just by fixing the right things, sometimes without adding a single new medication. Let us start with why sodium alone is such an incomplete explanation. When you eat salt, sodium pulls water into your bloodstream. More fluid in your vessels means more pressure pushing against their walls. That part is accurate. But here is what almost never gets mentioned. In a healthy body, your kidneys are constantly monitoring this. The moment blood pressure rises even slightly, healthy kidneys respond by flushing out the extra sodium and water through urine, and pressure comes right back down. This is why some people can eat salty meals regularly and never develop high blood pressure, while others react strongly to even small amounts. That difference is called salt sensitivity, and it varies enormously from person to person. So when someone cuts sodium and their blood pressure still will not budge, that is actually a clue. It tells you the sodium itself was never the true problem. The real issue is how the body is handling it, and that points toward the deeper physiological drivers we are about to cover. The first one worth understanding is magnesium, a mineral most people rarely think about when they think about blood pressure. Magnesium plays a direct role in helping your blood vessels relax. It supports the production of nitric oxide and prostacyclin, two compounds that widen blood vessels and improve blood flow. When magnesium is low, vessels stay tighter than they should, blood has a harder time moving through them, and pressure climbs as a result. Here is what most people do not realize. Magnesium deficiency is remarkably common. Some estimates suggest that close to half of adults do not get enough of it through diet alone. Large observational research backs this up. A pooled analysis covering more than 20 studies found that people with lower magnesium levels consistently had a higher likelihood of developing high blood pressure. And the lower the levels dropped, the greater the risk climbed. Why is this deficiency so widespread now? A big part of the answer is simply what modern diets are built around. Refined grains, sugary snacks, and heavily processed foods are all stripped of naturally occurring minerals, magnesium included. On top of that, eating a lot of added sugar actually causes your body to lose more magnesium through urine, compounding the shortfall even further. And even when someone does eat foods that are traditionally rich in magnesium, they may still be getting less of it than people did decades ago, because modern agricultural soil has been depleted of minerals faster than it can naturally replenish them. The food looks identical on the outside, but its nutritional density has quietly dropped. The practical fix starts with prioritizing magnesium-rich foods, such as leafy greens, legumes, nuts, and dairy. But given how depleted modern diets and modern soil have become, many people genuinely benefit from a targeted magnesium supplement, something absolutely worth discussing with your own doctor if you are dealing with elevated blood pressure. A recent, well-designed analysis, pooling 38 randomized controlled trials, found that magnesium supplementation, at a median dose of roughly 365 milligrams daily for about 12 weeks, produced measurable reductions in both systolic and diastolic blood pressure. The effect was notably stronger in people who were already on blood pressure medication, with systolic reductions approaching 8 points in that specific group. That is not a dramatic miracle cure, but it is a real, evidence-backed improvement, especially for people whose magnesium stores were already running low. Now let us talk about a hormone that rarely gets mentioned in these conversations at all: insulin. When insulin levels stay elevated for long stretches, your kidneys respond by holding on to more sodium instead of releasing it. This happens even if your dietary sodium intake has not changed one bit. Your body simply stops letting go of what it already has, water follows the sodium, and blood pressure rises as a direct consequence. This is exactly why people dealing with insulin resistance, prediabetes, or type 2 diabetes so frequently develop high blood pressure alongside those conditions. And here's the part that really matters. Blood pressure often starts improving once insulin levels come down, sometimes even before someone has lost any meaningful amount of weight. Salt can temporarily nudge your numbers upward, but persistently elevated insulin is what tends to turn a temporary spike into a chronic, entrenched problem. This is one major reason cutting back on refined carbohydrates, added sugars, and heavily processed foods often does more for blood pressure than simply avoiding the salt shaker ever could. This is where fructose enters the picture, and it deserves its own explanation. Fructose is a simple sugar widely used as a sweetener and preservative throughout the processed food supply. When you consume large amounts of it, particularly from sugary drinks and processed snacks, your body ramps up production of uric acid. Elevated uric acid interferes with nitric oxide, the same molecule that helps keep blood vessels relaxed, and it also makes vessel walls stiffer over time. On top of that, high uric acid makes it noticeably harder for your kidneys to clear excess sodium efficiently. This is one of the most overlooked details in the entire conversation around blood pressure. Reducing fructose intake and bringing uric acid levels back into a healthy range has, in many documented cases, allowed blood pressure to normalize without any additional medication at all. When lifestyle changes alone are not enough, some clinicians use a medication most commonly associated with gout to help address elevated uric acid, specifically when it appears to be contributing to the blood pressure problem. But the bigger takeaway here is simpler than any prescription. Cutting back on added sugars and processed foods improves both insulin resistance and uric acid levels at the same time, and addressing those two factors together can lead to a surprisingly fast improvement in blood pressure readings. Notice the pattern forming here. High blood pressure is almost never caused by one single mistake or one isolated habit. It is usually the accumulation of several smaller physiological stresses working together, quietly compounding over months and years until the numbers finally tip into a diagnosable problem. Now, let us bring potassium into the picture, because it works through two completely different pathways in your body. First, in your blood vessels and kidneys, potassium helps vessels relax, while simultaneously signaling your kidneys to release extra sodium through urine. In effect, it directly counteracts sodium retention and lowers pressure inside the vessel walls. Second, potassium also has a meaningful effect on your nervous system. When potassium levels rise, particularly around brain tissue and cerebrospinal fluid, it dampens activity in your sympathetic nervous system, the fight or flight response that is largely responsible for pushing blood pressure upward under stress. By calming that signal, potassium reduces the release of stress hormones that would otherwise keep your blood pressure elevated. The problem is that modern diets tend to be simultaneously high in sodium and remarkably low in potassium, which is essentially the exact opposite of what a healthy cardiovascular system needs. This imbalance alone can push blood pressure upward, even when total sodium intake does not look unusually high on paper. And when low potassium combines with elevated insulin, elevated uric acid, and low magnesium all at once, you end up with a kind of perfect storm that causes the body to retain sodium stubbornly and keep blood pressure elevated for the long term. If you want to naturally increase your potassium intake, some of the strongest options are root vegetables like potatoes and sweet potatoes, vine fruits such as tomatoes, cucumbers, and eggplant, leafy greens like spinach, and legumes including chickpeas, beans, and peas. Many of these same foods also happen to be excellent sources of magnesium, so you get a genuine 2-for-1 benefit from the same grocery list. Of course, this is not a complete or exhaustive list of everything capable of raising blood pressure. Other micronutrient deficiencies play a meaningful role for some people, and vitamin D is one of the more interesting ones. Low vitamin D levels have repeatedly been associated with a higher likelihood of developing high blood pressure, likely because vitamin D interacts with the same renin-angiotensin system that your kidneys use to regulate blood volume and vessel tone. Vitamin B12 deficiency, which becomes more common with age and with certain medications, can contribute to elevated homocysteine. And elevated homocysteine has been linked in research to stiffer, less flexible blood vessels over time. None of this means you should start supplementing blindly. It means these are worth discussing with your doctor and checking through simple blood work if your blood pressure is not responding the way it should. Chronic stress and poor sleep quality deserve just as much attention, even though they are harder to measure on a lab report. Ongoing stress keeps your sympathetic nervous system activated for far longer than it was ever designed to be, which means your body is constantly releasing the same fight or flight hormones that constrict blood vessels and raise your numbers. Poor sleep compounds this even further. Research on sleep and cardiovascular health consistently shows that people who regularly get too little sleep or whose sleep is frequently interrupted tend to have higher average blood pressure than people who sleep well. Conditions like sleep apnea in particular are strongly associated with resistant high blood pressure, and treating the sleep disorder itself often improves blood pressure numbers directly, sometimes dramatically. There are also less commonly discussed secondary hormonal disorders worth understanding, especially if your blood pressure refuses to respond no matter what you try. One of the more important ones is a condition called primary aldosteronism, where the adrenal glands produce too much of a hormone called aldosterone. This hormone tells your kidneys to hold on to sodium and release potassium, which is essentially the opposite of what you want for healthy blood pressure. Research suggests primary aldosteronism may be present in roughly 8 to as much as 20 or 30% of cases involving resistant, hard to control high blood pressure, which makes it far more common than most people, and even some doctors, tend to assume. It is diagnosed through a fairly simple blood test measuring the ratio between aldosterone and another hormone called renin, and when it is identified, treatment can be remarkably effective. These secondary causes deserve their own deeper explanation another time, but they are worth knowing exist if your numbers stay stubbornly high despite doing everything right on the lifestyle side. So what does a practical, realistic path forward actually look like if you want to address these root causes instead of just cutting salt and hoping for the best? Start by looking honestly at what a typical day of eating looks like for you. If refined carbohydrates, sugary drinks, and heavily processed snacks make up a large share of your meals, that is likely affecting your insulin levels and your uric acid at the same time, which means it is probably doing far more to your blood pressure than the salt shaker ever could. Shifting toward whole foods, particularly vegetables, legumes, and unprocessed proteins, tends to improve several of these mechanisms simultaneously rather than addressing just one. From there, pay attention to the minerals that rarely get discussed. Leafy greens, nuts, seeds, and legumes give you both magnesium and potassium in the same bite, which is part of why traditional, minimally processed diets tend to be so protective for cardiovascular health in the first place. If your diet has been low in these foods for a long time, or if blood work confirms a deficiency, talk to your doctor about whether a supplement makes sense for your specific situation. Do not overlook the basics of stress and sleep either, even though they can feel less concrete than a mineral or a lab value. Simple, consistent habits, like a regular sleep schedule, limiting screens before bed, and finding some form of daily stress relief, whether that is walking, breathing exercises, or simply stepping outside, can measurably lower the constant background activation that keeps blood pressure elevated. The most important takeaway from all of this is timing. Addressing these underlying factors early, before your blood vessels have had years to stiffen and lose their natural elasticity, gives you a genuinely realistic chance at bringing your numbers down meaningfully. Once significant structural damage has already built up inside the vessel walls, reversing high blood pressure becomes considerably more difficult, and medication often becomes a longer-term necessity rather than a temporary bridge. None of this means sodium does not matter at all, and it certainly does not mean you should ignore your doctor's advice or stop any medication you are currently taking. What it does mean is that sodium is only one variable in a much larger equation, and for a great many people, it is far from the most important one. If you have been diligently cutting salt for months with little to show for it, that frustration makes complete sense, because you were likely never addressing the actual mechanism driving your numbers upward in the first place. So, the next time someone tells you to simply cut the salt, remember that this advice is not wrong, it is just incomplete. Your magnesium levels, your insulin sensitivity, your uric acid, your potassium intake, your sleep, and your stress levels all deserve just as much attention, if not more. Small, consistent changes across these overlooked areas can add up to meaningful, measurable improvements in your blood pressure, often faster than most people expect, and often with far fewer side effects than jumping straight to another medication. Understanding your own body at this level is one of the most empowering steps you can take for long-term heart health, and it starts with looking far beyond the salt shaker toward the deeper, quieter forces that have been driving your numbers up all along.